The CBO says that your Medicare plan could more than double seniors' out-of-pocket costs. Is it realistic to assume that most seniors would be able to afford those cost increases?
A couple of things on that analysis. Number one, it fails to take into consideration the extra $7,800 we're talking about adding to low-income seniors' benefits. So what we're saying is protect those who are low-income by supplementing their benefits and covering their out-of-pocket costs. We're also saying as people get sicker, increase their payments to stabilize their premiums, and as people get wealthier, don't subsidize them as much. So it's really inaccurate to suggest that that's going to happen to everybody. But the other thing I would say is it's comparing Medicare to a fiscal fantasy, which is the current system is unsustainable and it's growing at rates that are unsustainable that will crash the system. And so the question is, what are the kinds of reforms we're putting in place to get at the root cause of health inflation, to make our healthcare dollars stretch farther, to inject competition into the system so we can stretch our dollar farther, and then subsidize people more who need it more and not those who need it less. And so it's really kind of an incomplete comparison to suggest that that's happening to everybody. Yes, wealthier people are going to pay more in the future, but more importantly, there's only so much money to go around. It's finite. And what we believe we should do is save Medicare so it's something that the next generation can count on and subsidize people who need it the most and not as much people who need it the least.